Dr. Michael Kirshenbaum is a gynecologist and reproductive physician who trained as an undergraduate at the Technion in Israel and completed a specialisation at Sheba, at one point chief resident of the obstetrics and gynecology department. She's currently undertaking advanced studies in reproductive services at the Royal Women's Hospital. Michael has a strong interest in reproductive endocrinology and infertility, and she's a mother of 3. And she's been here for about 5 months. 6, yeah, correct.
Thank you.
Okay, now, I didn't know this until I met Michael just before, but Michael had never seen this documentary.
Yeah, first time.
So, that makes it a very easy first question. Michael, what are your impressions and what does this documentary mean for you?
Yeah, so first of all, it's a pleasure to be here and a great honor, so thank you. And thank you for coming and watching this first time documentary film with me. You know, until now I didn't have the opportunity to finalize or process the experience I had in Ukraine. And I hope that now that I have this visual summary, I will finally be able to do it. I mostly feel proud that I was part of this mission, proud of my country, of Sheba Medical Center, of my department and family that supported us. But I also feel very sad knowing that the war condition is still going on in Ukraine and Russia. And it is very challenging to work under those conditions with people that are truly experience a threat on their existence and on their home and lives and family. And what we try to do is to give them treatment, but also hope by showing them empathy and compassion and trying to understand what they are going through. And I hope that we were able to leave a long-lasting impact on the people and patients that we met.
In disaster management terms, we talk about 2 P's and 2 R's. There's prevention, preparation, response, and recovery. I guess I want to ask you, certainly we couldn't prevent what was happening, unfortunately, but how did you prepare when you found out that you were going to go on this mission? What did you do at home before you left? How did you make arrangements to go? And how did all that transpire in the days leading up to it? How much notice did you get before you knew you were going to be going on a El Al flight to Poland?
Yeah. So from what I remember, there was 2 weeks of very intensive preparation and instructions. We had daily briefings. We assessed the local area where we assumed that we are going to build the hospital, and we assessed the population that we expected to treat. We contacted the local hospital there and the local medical staff in order to collaborate with them. We worked with Sheba's pharmacy in order to have all the medication needed, and with the technical staff to prepare all the equipment needed. We had safety and security instruction, knowing how to react to various conditions that we might encounter. And I felt that we were very well prepared and equipped. For most of us, this was the first time that we took part in a mission like that. But the directors and the managers of this delegation were very experienced, and I felt that we have someone to count on, and I felt very reassured. My husband, my partner, he's the one that pushed me towards the decision to take part in this mission, so he was 100% supportive through the whole way.
And were you expecting to treat patients in your specialty, so pregnant women? Were you expecting that you would be doing other things? Were you prepared to potentially work outside your normal scope of practice?
Yeah. So I think that none of us really knew what to expect or for which medicine we will be required to. So we just prepared for everything. And you saw the amount of equipment and medication that we took with us. I felt that we came in order to treat the patients that will reach us for help, all patients, regardless of their medical conditions. And we mainly treated the local community there, but also refugees that were forced to leave their homes and immigrate west. We treated chronic patients, which treatment was interrupted by this awful reality. We also treated emergency cases of pregnant women with bleeding and premature contractions and reduction in fetal movement. So there was a whole variety of patients that we needed to respond to.
We saw in the documentary that a woman gave birth to in the maternity or the labour room. It was said that there were no elevators, so the operating room was on the second floor or the first floor, and the maternity was on the floor above it. When you got there, having had your education in Israel and in the West, so to speak, when you got there, what was your impressions of the hospital and what you would have to do in that hospital?
Yeah. So maybe in terms of Israel or Australia, we wouldn't call it an hospital, maybe just a local medical center. But I felt that they do know how to work under those conditions, and we had collaboration between us. I learned a lot how to work under unfamiliar conditions with the help of the local staff. And the cesarean section that you saw in the film is a woman that was under their care during the whole pregnancy, and we were invited to participate in her cesarean section. It was very exciting, and it was good that we were there, and the pediatrician also helped the newborn, so it was a great luck.
With the point about coming in and then having to leave after 42 days, how did you integrate with the local doctors and nurses, and are there any things that you have lasted since you've come back to Israel, or any associations that have continued?
Yeah, so Professor Baron, one of the directors of the delegation, always told us that whenever a mission like this ends, we leave a huge vacuum behind. So we try to do things that will leave also an impact after we end this mission. Local physicians joined us for the work during the days, and we also conducted some courses of basic life support and trauma life support. So I believe that by doing this, we did leave the long-lasting impact that we were aiming to.
So that's part of the capacity building, trying to increase the capacity of the local people to look after themselves and to provide healthcare. The equipment was donated, all the perishable equipment was donated to the communities. How did you decide what you were going to leave and what you were going to take?
Yeah, so to be honest, it wasn't my decision. It was the director decisions, but as they said, I mean, all disposable equipment just left there for donation.
And I think one of the things I'm interested in is however well you prepare for a mission, whether it's a military one or a civilian one, the logistics is always about trying to predict what you're going to need. And so sometimes what you think you're going to need, you don't have with you. Was there anything either in your own specialty or the specialty of others that you got there and then said, oh, I just wish I would have taken this piece of equipment, or I need this resource and we just didn't plan for it? Was there anything that maybe you think along those lines?
Yeah, so there are several levels of field hospital, and from the beginning we knew that we will not have an operation room or blood bank, so we were not prepared to treat those kind of conditions. I think that we were very well equipped, and I didn't feel that we missed anything. I think that if anything was needed is more working hands and more staff members, because as the days went by, we treated more and more patients, and the waiting time became longer. So more staff members were needed for sure.
I want to ask you a little bit about your personal reflection on the impact of the deployment on you. You said it was the first time you've ever been deployed. Were there any moral or ethical challenges that you faced or your colleagues faced while they were there? Was it related to the people, what you were treating, the fact that you're in a war zone? What were those challenges on a personal level?
Yeah. So on a personal level, and also from talks I had with the other members of this delegation, I felt that we all came without any political agenda. I mean, we all came as persons and as physicians representing our hospitals and countries. And working in a war zone is very hard, but you know, in Israel, the political situation is always very complex, and unfortunately we had several times of working under war condition and bombing, so this situation is not unfamiliar to us.
They say that the impact of a disaster is related to the nature of the hazard, which in this case is a war, and the resilience of the people as well as their vulnerabilities. I wonder, what did you see or learn from the Ukrainian people?
Well, I felt that they are very much connected to their country, and I felt that they will do anything that they can in order to defend and protect it. I felt their fear, and I felt that they truly understand the situation and its implication. You saw in the film mothers who sent their sons to the war, women who sent their husbands or partners to fight in the war. So the situation is surrealistic. You cannot understand it. I mean, it's non-comprehensive. It is very tough.
It's very tough. Is there any patient or clinical incident that you remember that stands out? I mean, we all, as clinicians, we all can remember a patient from 5, 10, 15, 25 years ago. It just sort of stands out in our memory for whatever reason. From your time in the hospital, the field hospital, is there any patient that sort of you remember for any of those reasons?
Yeah, so every patient wraps a whole world. But there were several patients with outstanding stories. One patient was very young. She was 22 in her first pregnancy, and she came to us on her 30 weeks of gestation with a reduced fetal movements. She was very terrified. She had to leave her home and migrate west. And we did an initial investigation which included an ultrasound and a fetal heart monitor, which showed deceleration in the fetal heartbeat. So we contacted the local hospital, and we were able to arrange her hospitalization there, and we did daily assessment with the local staff there. And eventually she was discharged, and we gave her like a home fetal monitor, which she was able to use. And we instructed one of the local physicians there how to use it as well. And eventually we kept in touch, and we know that she gave birth on term, a healthy baby.
Fantastic. And we did see in the documentary the use of the portable monitoring, the Taito, where we had the fetal heart monitoring, we had the physician in Israel listening to the heartbeat of someone in the Ukraine, and it's just absolutely fascinating. And many of these things have been accelerated through Corona and the need to develop some of these telemedicine things. I'll finish off shortly, and I think there are two questions. One of them, I think, is your reflections about your team, and the other is what's different about you having had the deployment to before the deployment.
So, regarding the team, I think that I had the amazing opportunity to meet wonderful people who joined this delegation out of altruism and out of the will to give from their knowledge and resources to people in need. And if I may say, I think the best of the Israeli community. And we became true friends. We lived together for 2 weeks, 24/7. We slept 20 women in one classroom, so it was challenging, but on the other hand, it gave us the opportunity to bond and to release some stress from the experience of the day. And regarding myself, as I said, I haven't truly finalized this experience, but seeing this huge thing makes me so proud of Israel, my country, of Sheba Medical Center, that even in hard times is able to reach out and help other countries and people in need. And you know, the humanitarian missions are still going. I mean, this is not the only mission that Israel or Sheba has done. And I'm proud to be part of this.
I think on that note, we would like to say we're very proud of you, and we're also proud of all the people that undertook this incredible humanitarian mission. And I think it's time that we show our appreciation.